I'm Dr. Walter Hoyt, and I'm here to talk with you about sudden cardiac arrest. First, let's begin on reviewing on how the heart normally pumps blood to the body. The heart is organized into 4 chambers, 2 top priming chambers and 2 bottom main pumping chambers. The chambers' walls are made of muscle. The squeezing and relaxing of the muscular walls moves the blood through the heart and out to the body. Each part of the heart muscle knows when to squeeze by an electrical impulse moving through it. Each electrical heartbeat normally begins at the top right of the heart. From there, that impulse travels like a wave through the top chambers, transferred across to the bottom by specialized electrical tissue, and then throughout these main, bottom, or ventricular pumping chambers. The heart then gets ready for the next beat, where it all begins again in the top of the heart. The heart muscle uses a lot of energy and itself must be supplied with oxygenated blood, which gets there by the coronary arteries. Here we see the path blood takes through the heart. Blood comes into the right side of the heart from the body, where oxygen was removed by the body's tissues. The right side of the heart then directs the deoxygenated blood into the lungs, where the blood picks up oxygen. Blood then travels to the left side of the heart, where it is pumped out of the heart into the body. Sudden cardiac arrest occurs when the heart suddenly stops pumping effectively. This is usually due to a particular condition causing an arrhythmia, which is an abnormal heart rhythm. The arrhythmia involved in most cases of sudden cardiac arrest is called ventricular fibrillation. Ventricular means the ventricle of the heart, which is the part of the heart that is the most responsible for pumping blood to the body. And fibrillation is a very rapid and irregular rhythm which causes chaotic contractions of the heart's muscle fibers, so the heart is no longer beating and pumping in a coordinated or effective way. If the heart stops pumping, then blood stops flowing to the heart, brain, and body, and death ensues. There are potential risk factors for sudden cardiac arrest. These include heart disease such as coronary artery disease, cardiomyopathy, which is a heart muscle abnormality, some congenital heart disorders, prior sudden cardiac arrest, family history of sudden cardiac arrest or unexplained death, and this could include a single car accident or an unexpected drowning that was actually caused by a person having a cardiac arrest. Heart rhythm disorders, electrolyte derangement, syncope or passing out of unclear cause, obesity, diabetes, recreational drug use, and some medications. These risk factors help physicians and other caregivers recognize the potential presence of an underlying cardiac condition that could cause a sudden cardiac arrest. Cardiac conditions that predispose to a sudden cardiac arrest can be divided into 3 categories: structural, electrical, and situational. Structural include problems in the formation or structure of the heart, which include hypertrophic cardiomyopathy, which is a thickened heart muscle, dilated cardiomyopathy causing a stretched heart muscle, and anomalous origin of the coronary artery. Electrical heart problems are conditions that directly predispose someone to a dangerous arrhythmia. Examples of these include long QT syndrome, arrhythmogenic right ventricular cardiomyopathy. Situational heart problems are issues that may be acquired or only occur in a specific set of circumstances. Examples of these include myocarditis and Commotio Cordis. Myocarditis is heart inflammation that is associated with some infections, autoimmune conditions, and medications. Commotio Cordis is a sudden chest trauma at a specific time during heart rhythm that causes an arrhythmia. Some heart problems can present with symptoms. These may include chest pain, shortness of breath, extreme fatigue, diminished exercise capacity, fluttering feelings in the chest, and lower extremity swelling. That being said, sudden cardiac arrest can often be the first symptom of an underlying cardiac condition that predisposes to a cardiac arrest. This means you can not always rely on prior symptoms to know who may be at risk for sudden cardiac arrest. This underscores the importance of being able to recognize and respond to a sudden arrest with CPR and an AED. Also notable is that these signs and symptoms are often caused by non-cardiac issues. Patients should discuss any of these findings with their primary care physicians.